Welcome to the PTRC Area Agency on Aging Family Caregiver Support Program, ARPA Mini Grants, recording number 3. This recording will provide information about the PTRC Area Agency on Aging's American Rescue Plan Act Family Caregiver Support Program, Caregiver Supportive Services Mini Grants. In March of 2020, our region, Region G, entered the beginning of a national pandemic that has negatively affected older Americans and their family caregivers. As we begin 2022, we are hopeful that this pandemic can be behind us and that we can begin a national recovery. This request for application is for grant opportunities funded by the American Rescue Plan Act of 2021, or ARPA. ARPA funds provide a unique opportunity to consider the needs and service delivery that have potential to respond to the needs of older adults and family caregivers. The Piedmont Triad Regional Council Area Agency on Aging is taking a regional approach to distributing these funds based on the priorities established by the North Carolina Division of Aging and Adult Services. Service matches are not required, and funds will remain available until they are expended or until September 30th, 2024, whichever comes first. Again, the funding project period is May 1st, 2022 through September 30th, 2024. Additional information will be available on the PTRC website under the specific Family Caregiver Supportive Services link. PTRC Area Agency on Aging is making 5 of these mini grants available for supportive services. There will be 5 mini grants of $25,000 per grant. Eligibility for Family Caregiver Support Program services is important to note. This eligibility includes any person of any age providing unpaid care for an older adult age 60 or over, or providing care to an individual with Alzheimer's disease or a related dementia. A relative caregiver, not parent, aged 55 years or older, living with and raising a relative child aged 18 or under, or a relative or parent, 55 years of age or older, living with and raising a disabled adult child aged 19 to 59. Please note that there are special eligibility requirements for respite services under the Family Caregiver Support Program. For these categories, the care recipient must meet the definition of frail as specified by the Older Americans Act by being either unable to perform at least 2 activities of daily living without substantial human assistance, including verbal remindering, physical cueing, or supervision, unable to perform the activities of daily living, which include eating, dressing, bathing, toileting, transferring in and out of a bed or a chair, and ambulation, meaning walking or moving around the home without any assistance. Or who is due to a cognitive impairment and behaves in a manner that poses a serious health or safety hazard to the individual or to another individual. Family Caregiver Supportive Services Program supportive services goals include for the caregiver to be empowered through education, to be informed of services available to them that can support their own well-being, and to be connected to support systems that can help reduce their levels of stress, social isolation, and caregiver burden. Supportive services will be provided through vouchers that offset a caregiver's loss of income and the increased expenses of caregiving. These vouchers could include vouchers for limited groceries and grocery delivery, limited medical transportation, gasoline and car repair, limited internet access to reduce isolation, yard work, limited housekeeping, or a limited number of one-on-one counseling sessions with a licensed therapist for caregiver crisis and assistive technology. Assistive technology is defined as any item, piece of equipment, or product that is used to increase, maintain, or improve functional capabilities of an individual with a disability. And for the purposes of the Family Caregiver Support Program, these items include equipment and products that can help caregivers maintain or improve a care recipient's functional capability at home. Types of services included in this mini grant include administrative functions, service delivery functions, such as handyman yard work, assistive technology, home modification, accessibility, personal emergency response systems, incontinence supplies, liquid nutrition, and more. Further definition of this, these services can be found in the Family Caregiver Support Program Manual version 2020, and that can be located on the North Carolina Division of Aging and Adult Services website. Best practices also include services that can broadly be thought of as home improvement or provide consumables in the home that aid the caregiver in keeping the care recipient at home for a longer period of time. Other programmatic requirements for the Family Caregiver Support Program services. Please note that as of July 1st, 2012, clients receiving Family Caregiver Support Program respite and/or Project Care respite may receive a total of up to a limit of $2,500 per fiscal year through both programs. Arpa Family Caregiver Supportive Services, older adults as caregiver funding also includes non-unit reimbursement for personal protective equipment and other unique items that allow organizations to provide protection against COVID-19, although no more than 5% of the total allocation may be used on this PPE. There are reporting and documentation requirements. At a minimum, a case file client record documentation should include a completed North Carolina Department of Health and Human Services DAAS 101, also known as the client registration form. A signed consumer contribution policy, a narrative in the case record indicating why the service is needed, documentation of the service type and units provided and reported, including timesheets, fiscal tracking, assurance of confidentiality, documentation that the client is made aware of a grievance and appeals process as part of the Client Bill of Rights. Best practice includes completed assessment and subsequent reassessments, copy of a plan of care and services signed both by the Family Caregiver Support Program representative and the client, and a narrative documenting communication and decisions made, progress notes, and service termination as appropriate. Cost computation requirements are required for this program. An accurate completed Family Caregiver Support Program budget will be required of all mini grant recipients who are awarded the grant. Reimbursement for Family Caregiver Supportive Services is made through the Aging Resource Management System, also known as ARMS. And please note that reimbursement is dependent upon accurate reporting of service data. Monitoring of all recipients is required, and they will be monitored by the PTRC Area Agency on Aging according to a timeline established by the North Carolina Division of Aging and Adult Services. Confidentiality and security of client records is expected. Client information in any format, whether recorded or not, shall be kept confidential and not disclosed in a form that identifies the person without the informed consent of the person or legal representative. Record retention and disposition. All community services providers are responsible for maintaining the custody of records and documentation to support allowable expenditures of funds. Service provision and the reimbursement of services. Service providers must adhere to approved record retention and disposition schedule posted semi-annually on the website of the North Carolina Department of Health and Human Services controller. And that information is located on the North Carolina DHHS website. The project period again is May 1st, 2022 through September 30th, 2024. Should be noted that the PTRC, Area Agency on Aging, reserves the right to reject any or all applications, to waive technicalities, and to be the sole judge of suitability of services for their intended use, and further specifically reserves the right to make the award in the best interest of the PTRC, Area Agency on Aging Regional Program. What follows is on the request for application is the actual submitting the application for the mini grant. Please note that 3 copies of the RFA with original signatures must be submitted to the PTRC AAA at 1398 Carrollton Crossing Drive in Kernersville to the attention of Gwen Shields no later than April the 1st, 2022 at 4 p.m. Applications received after that date and time will not be considered for funding. Proposals that best meet the PTRC Area Agency on Aging expectations for service delivery will be selected. Applications will be scored based on their completeness and their description of intent to provide services. Remember that all questions regarding the RFA must be submitted in writing by March 23rd, 2022 at 4 p.m. to Gwen Shields at ptrc.org. Her email address is included at gshilds@ptrc.org. After such time and until projects are awarded, applicants will be prohibited from contacting PTRC Area Agency on Aging staff regarding any issue relating to these funds or the application process. Failure to respond to any requirements outlined in the RFA or failure to enclose completed copies of the required documents may disqualify the application. What follows next is a timeline. Obviously, the announcement of funding availability, which is taking place now. These information sessions, which are pre-recorded and which can be accessed by clicking on the link within the RFA. Please remember, again, final day to submit questions is March 23rd, 2022 at 4 p.m. The applications are due at the PTRC Area Agency on Aging office no later than April 1st, 2022 at 4 p.m. And announcement of awards will be made during the week of April the 25th. Also note once again that upon award of a grant, an official budget will be completed using the required Arpa Family Caregiver Support Program budget paperwork. PTRC has developed a scoring tool to evaluate the applications, and that tool will be available on the PTRC website under the specific Family Caregiver Supportive Services link at ptrc.org/services/pandemic-recovery-funding-opportunities. Again, 5 mini grants of up to $25,000 each will be awarded. It's expected that all expenditures will be reasonable, necessary, and justifiable, and that all funds will be spent on activities related to that mini grant. Any organization may submit one application to provide services to multiple locations and/or counties, but requested grant amounts cannot exceed $25,000. Monitoring will take place. All services provided by the Arpa Family Caregiver Supportive Support Program supportive funds will be monitored by the PTRC Area Agency on Aging according to a timeline established by the Division of Aging and Adult Services. Following all that information is the Arpa Family Caregiver Support Program supported services request for application. Again, it includes the information required about original signatures on 3 copies. There is information to complete about the project contact information, and that contact information section must include the tax ID number, a DUNS number, a valid DUNS number, and the type of agency that is making this proposal, whether that agency is a nonprofit, a for-profit, a government entity, or other. Then there are 5 application questions. You may expand on the space that's provided, and your word count is not limited on those questions. There is also a budget proposal section where we'd like you to itemize what is being included in your request. Try to be as specific as possible on your personnel costs. And your budget could include, for this type proposal, such things as staffing at so many staff hours at $50 per hour, cleaning supplies, assistive technology, so many grab bars at a total of. But remember that no more than 5% of the total allocation may be spent on PPE and other unique items to protect against COVID-19. And once again, upon award of the grant, an official budget will be completed. After that, there is an American Rescue Plan Act bid certification statement and the execution of the RFA. Will require a printed name, the authorized signature, and title, and a date. And once again, recall that upon submitting this RFA, we will require 3 copies, all with original signatures and date. I'd also encourage you to thoroughly read the RFA on your own. And if you have any questions, to please contact Gwen Shields at the PTRC Area Agency on Aging in writing by March 23rd, 2022, no later than 4 p.m. Thank you.